We're now joined by Valerie Arkoosh. She is the chair of the Montgomery County Board of Commissioners. Thank you for joining me.
Great to be here.
Now, the Pennsylvania counties have announced that at the beginning of the year that state funding of mental health services was a priority. Why was that so important?
Well, mental health funding has been a top priority for the counties for a long time, but it's now reaching crisis stages. And so we reached out to our delegations in Harrisburg to ask them to make one of their top priorities for fiscal year 2021. The reason is that the base funding that counties receive to provide mental health services has not had a cost of living increase since the 2007-2008 budget. So in my county of Montgomery, that means that if we just had a simple cost of living adjustment all of those years, we would have $7 million more of purchasing power than we do right now. And in addition to not having the cost of living adjustment, there was an actual cut to mental health funding. That happened in 2012, and that was a 10% cut. And none of those dollars have been restored either. So counties are really at the breaking point. We literally have providers giving notice on their contracts because they cannot hire people to do the jobs that are needed with the money that's available to them to provide those services.
Can you talk a little bit about the types of services that are provided? Are these provided directly by the county, or does the county finance them through nonprofits or other organizations?
I can't speak for every county, but here in our county, we do put out RFPs for contracts for providers. And this portion of the money, this county-based funding, goes to a number of different areas. In our county, it primarily goes for housing and residential treatment. It provides for our mobile crisis unit. It covers anyone who doesn't have health insurance. And what I think a lot of people don't realize, if they've never actually used their mental health services under their private health insurance sometimes only covers a very short period of time for mental health services, particularly when it comes to inpatient. They may only cover 2 weeks when a person needs much longer than that. They don't cover a lot of these crisis intervention services that are really critical to keeping people out of jail or harming themselves by intervening right there in the moment. So the county fills all the gaps that exist in our private health insurance system around mental health funding and services.
Now, when the COVID-19 crisis hit, how did that impact the availability of services?
Yeah. Well, it's really been a very, very challenging time, obviously. So, we go into the coronavirus pandemic already very tightly funded in terms of our mental health services. And what we've seen here in Montgomery County is an increase in individuals who, for the first time, are seeking mental health services. And not surprising at all. This is a time of enormous uncertainty and anxiety for everyone. So we're seeing a lot of new individuals reaching out for services. Fortunately, we have been able to keep our mobile crisis unit up and running. The provider that provides that service has been able to keep that running. So we have been able to do that. We've very quickly switched over to providing a lot of services online, a lot of telemedicine, teletherapy. There are AA meetings and the whole bit. Everything has gone online so quickly. I mean, I just really commend all of our partners for getting that done. But if anything, the need for services has absolutely increased.
Was there any funding from the federal government that came into the counties to help supplement this the services?
So we have gotten an allocation of the CARES funding, and we are still sorting out whether or not we can use CARES funding specifically for this. But I don't have the answer to that yet. But I'm not aware of any other funding sources that have come through for mental health.
Now, at the state level, is there anything associated with, say, a declaration of emergency or any kind of special funding from the state that came into the counties?
Not that I'm aware of at this time.
What kind of response have you received from your legislative delegations?
I think on the whole, they've been very, very supportive. Here in Montgomery County, we have a bipartisan delegation that works well together, and I think everyone understands the importance of mental health and behavioral health funding. Our goal here is one that's shared across our Montgomery County delegation, which is that we want to build healthy and safe and resilient communities. And with more funding, we would be able to do some very specific things. We would be able to expand our student assistance programs, which work in our school districts to help identify problems when people are young, coming up through school at a time when it's relatively straightforward to intervene and offer services that could impact the rest of that person's life. We want to expand our diversion programs that we operate with the local police and our courts so that people with serious mental illness aren't going to jail. That is not the best place for somebody with serious mental illness. Those people need to be in treatment, not incarcerated. We would work with our veterans to expand programs for veterans' mental health. We have as a priority in this county eliminating homelessness for people with mental health challenges. And this is often a very, very big issue for them. And yet without that stability of a home, it's very hard to fix other things and get people back to work, which is, of course, the final thing, is working with our employers and our clients to get as many people employed as possible. So these are all the things that are being cut, pinched, programs have been cut. We just simply don't have enough funding to do these kinds of services. And these are the very cost-effective preventive services that can make such a difference in a person's life and keep them out of jail, from being hospitalized, and keep them in the community functioning and contributing.
Now, you're in Montgomery County, and from the beginning of the coronavirus crisis, that's been an epicenter of many of the infections. What's the current state there?
Well, we currently are still, at the time of this interview, in the red phase, but we will be moving to yellow on Friday, June the 5th. So we're very much looking forward to that. A lot of questions, a lot of concerns as we move to opening up, but also a lot of relief. I can't wait for our county to get back to work and as safely as possible. Some of our businesses will finally be able to begin to operate, maybe in a little bit different way than they were operating before, but hopefully they'll be able to start getting people back to work. So we're looking forward to that. But we're very, very aware that here in our county, there is still a lot of virus out there, and that people are going to have to be personally responsible in their actions and do everything they can to help prevent any spread of this virus.
So as far as the reopening process goes, how much say does the county government have in terms of who reopens and what kind of process is undertaken?
Yeah. Well, the county government really doesn't have the lead on who can reopen, because the governor has taken that initiative with his orders and the waiver process and other things that he's put in place for the business community. So when it comes to who actually gets to open, that's going to be largely still at the state level and with DCED. But we're providing a lot of guidance and support to everyone in our community. Our commerce director, for instance, has been having a weekly call with our chambers and many in the business community, offering support and guidance. And the county has been offering grants to our business community. We've had 2 rounds of grants now for our small business community. In total, those 2 rounds are $6 million of grants, not loans, but grants going to our small business community. We are really hoping that everybody gets through this, and we're doing everything we can to help.
Now, is there any action by the General Assembly that you would like to see taken just in general regarding coronavirus that would help you through this process?
Well, I think that there's a lot of things that are likely to come up over the next 6 months to a year until we have a vaccine available. And where we really need the delegation's help are on things that are things like voting, where large numbers of people have to come together to undertake that civic responsibility, and we want that to be as safe as possible. And so there's just some very practical things, like many people are choosing to mail in their ballots for the primary, which is great. That's now allowed under our law. But the United States Post Office is similarly affected by this pandemic, and things are not moving as they would normally. And so much of the mail is being delayed. So things like extending due dates for when properly postmarked ballots can be returned to the county, and things like that require legislative action. I really hope that we can depoliticize this a lot and just be practical about it and look at very, very real consequences of this virus and steps that we need to take to keep people safe, and just take some of these very practical, pragmatic steps over this next year.
Well, Valerie Arkoosh, Chair of the Montgomery County Board of Commissioners, thank you for speaking with me.
Thanks so much.
Zach Shamberg is the President and CEO of the Pennsylvania Healthcare Association. Thank you for joining me.
Phil, thanks for having me.
Tell us a little bit about your organization. Who does it represent?
Sure. Yeah, we're a statewide advocacy organization. We're located 2 blocks from the Capitol building here in Harrisburg. And our primary goal, or our primary role right now, is to fight for long-term care providers, to fight for their frontline staff, and most importantly, to fight for their residents that they serve every day. We represent long-term care providers in general, but specifically nursing homes, personal care homes, and assisted living communities. And across the entire state, from Philadelphia to Pittsburgh to Erie to Scranton, we represent more than 400 nursing homes, personal care homes, and assisted living communities. At the end of the day, we're really the conduit between the providers on the front lines and those in state government here in Harrisburg. And I can't think of when our association has had a more important role than now during the COVID-19 epidemic.
Now, on May 19th, the Pennsylvania Department of Health issued a report on coronavirus and nursing homes and long-term care facilities. What was in that report?
Yeah, so this is a report that we've been asking for really since the epidemic began, and it was facility-specific information for nursing homes, personal care homes, and assisted living communities. Right now, or at least for the last few weeks and really the last 2 months, the Department of Health has been publishing county-specific data. So you can go on the Department of Health's website and you can see county by county the number of positive cases and the number of deaths that have occurred. Other states, including some of our neighboring states, had already made the move for long-term care because it affects long-term care more than any other part of the healthcare continuum, and senior citizens, those we serve, more than any other segment of the population. Other states moved to publish facility-specific data weeks ago. And the Department of Health on May 19th first made that move and put out for the public, or for public consumption, facility-specific information, number of positive cases, number of staff cases, and ultimately the number of deaths that have occurred in each facility.
Why is it important to have that level of detail at a facility-specific level?
Yeah, again, since the beginning, this is something that we at the Pennsylvania Healthcare Association, as well as our membership, have really advocated for. We've supported transparency, and most importantly, we've supported communication. We've led the charge, really, to publicly post this data. And since the beginning of the epidemic, and even long before that, we've asked our members, or we've instructed our members, whether it's a nursing home, personal care home, or assisted living community, be forthright about the data, be forthright about the number of cases that you have, communicate with the families and the loved ones of your residents, especially as we're talking now about reopening Pennsylvania. And we're doing that on a county by county basis. I think it's important to let the public know, here's what is happening in the nursing home in your community. Here's what's happening in the personal care home or assisted living residence, and make sure that they understand and have that data. One of the things, Phil, that we've also really advocated for is, if we're going to publish the data, one part of it is education, and that's important. The other part is for the Department of Health and those who regulate long-term care facilities to ensure that as we see higher and higher numbers or more and more positive cases, that we redirect our efforts and aid those facilities who need it the most. So let's not just publish the data, let's use it for good.
Now, your organization issued a press release expressing some concern about the accuracy of some of the data in there. What were your concerns there?
Yeah, we had grave concerns, as did our members, because here's what happened. The data was published at 1:45 p.m. By 2 o'clock, our phones here at the Pennsylvania Healthcare Association had already been ringing off the hook. Minutes after this data was published, it became very clear to providers across the state that the data contained inaccurate information about many of those providers. And the data that was posted by the Department of Health just didn't match with the data that providers had already been submitting to the Department of Health for many weeks. I mean, I think it's important for your viewers to understand that most long-term care facilities in Pennsylvania through this epidemic have been reporting to up to 7 different databases within the Department of Health. So while you're trying to care for residents, while you're trying to protect staff, while you're trying to procure testing and personal protective equipment, the Department of Health has mandated that you as a provider report to up to 7 different databases on a daily or weekly basis. So with all that information flowing, to still post incorrect or inaccurate data would really hit home for a lot of the providers who are spending hours every day compiling these numbers.
How did the health department respond to your concerns?
Yeah, so we reached out immediately. We spoke with the Department of Health that evening, and we had a meeting with the Department of Health as well as the governor's office the following day. And they admitted in that meeting, as well as in a few public statements since then, that the data was inaccurate. And, from the Pennsylvania Healthcare Association standpoint, again, in talking to our providers and hearing about the frustrations on the front lines, we advised the Department of Health that if they didn't take immediate action to correct the numbers and take down the inaccurate information, that we would have to explore all of our options. And, unfortunately, as much as I hated to say it then, that included potential legal action to get the truthful data posted as soon as possible.
So where are we right now? What's happened in the time that you initially expressed your concerns?
Yeah, so we're almost to a week at this point. And if you look on the Department of Health's website now, you can see that facility by facility or piecemeal by piecemeal, the department is updating some of this data. And look, Phil, I'm here to tell you, and I can tell your viewers, that's simply not good enough, because here's where it really comes into play and it really makes an impact. Put yourself in the shoes of a son or a daughter or a grandson or a granddaughter or the wife or a husband of someone in a long-term care facility. And you've been communicating with an administrator or an executive director or a staff member every day. And you've been told day after day, here are the number of cases, here are the number of staff who have contracted COVID-19, and here are the number of deaths that we've had, unfortunately, in this facility. And then the Department of Health puts out their numbers, and they're wildly inconsistent or different. What are you going to do first? You're going to feel betrayed. And facilities have worked for weeks throughout this epidemic, especially as visitation has been restricted, so that we can't even go in to see our loved ones in our nursing homes, in our personal care homes, in our assisted living communities. Staff has really tried to build a sense of trust. And when those numbers were published last week, that trust, unfortunately, was broken. And every day that incorrect data stays up, it is a harm to the public of this state.
Now, another issue surrounding nursing homes and long-term care facilities was the issue of testing. The governor has issued a plan for testing. What is that plan, and what does your organization think about that?
Yeah, it's a good question. A few weeks ago, the Department of Health Secretary Levine held one of her press conferences, and she said, we are going to very clearly test all residents and staff. And that was music to the ears of our association, as well as providers across the state. This is something that we've advocated for since the very beginning, because it's impossible to adequately care for frontline staff and, most importantly, for the residents if you don't know who has the virus. I mean, we're doing things in our facilities such as cohorting, and that's creating facility-specific or COVID facility-specific wings, floors, sections of the building, so that we can try to contain the virus. Well, if we don't know who has it and we don't have the ability to test, that's almost impossible to do. It's almost impossible to procure the right amount of PPE or personal protective equipment. So when the secretary made this announcement, we felt as though we had been heard and that this industry had been heard. However, guidance was then published, and guidance went out to providers all across the healthcare continuum. And what the Department of Health said was, this is not necessarily a mandate. It's not necessarily even a recommendation. It's a strategy. Now, we're still trying to figure out what that means for frontline providers, and providers are confused. They're trying to figure it out. As we talk again about reopening, I have believed since the beginning, and we have believed, that long-term care is the key to reopening the rest of the state, and really states all across the country. If we can get providers the testing that they need, the PPE that they need, absent a vaccine, and we're probably a year away from that, that's a big step for getting us back to where we need to be as a state.
Now, you mentioned PPE, personal protective equipment. Have your members been able to have access to all the equipment they need, or where are their needs that need to be filled?
Yeah, we're not there yet. And when this really began, when the first reported cases of COVID-19 occurred actually in a nursing home in Washington State, the Kirkland Life Care Center, nearly 2 months ago, we reached out to that facility as well as our counterparts in Washington State, and we said, what do we need to be ready for here in Pennsylvania? The first thing they told us was PPE and personal protective equipment, whether it's masks, gowns, gloves, or goggles, that those were going to run short right away. And sure enough that they did. We found out that nationally there was a shortage, statewide there was a shortage, and all the production of personal protective equipment was actually done in China, and not only just in China, but in the Wuhan province where the COVID-19 epidemic began. Since then, it's really been every provider for themselves, trying to procure PPE from other states, from other countries, working alongside one another. We, from an association standpoint, started working with Harrisburg University here in the city to actually have them 3D print face masks for providers. And while that sounds really cool and it sounds really great, and it is, they've done fantastic work, it's a sad commentary as to where providers were and where they still are. We've been fighting, I'm going to keep saying it, for priority. It's been all about priority. And providers on the front lines, our long-term care providers, need to be prioritized by the state and federal government when it comes to PPE allocation.
Now, one of the things your organization has advocated for is a long-term care ambassador. Why is that important? What would that do?
It's interesting. Working with the Department of Health, because their purview is over so many different parts of the healthcare continuum, we think that what we're dealing with on the front lines of long-term care as it relates to the COVID-19 epidemic warrants someone who will spend every waking moment doing what they need to do and prioritizing long-term care in the eyes of the state. Again, when we look at the fight that we've had over when it comes to hospitals and other healthcare providers, the data doesn't lie. More than 500 long-term care facilities across the state have reported at least one COVID-positive resident, and nearly 70% of all COVID-19 related deaths have unfortunately occurred in long-term care facilities. My question when I testified before the House and Senate Aging Committees 2 weeks ago was, what are we waiting for with numbers like that? So that's why we've advocated for an ambassador, somebody who's going to put long-term care front and center and make sure that providers get the help that they need.
Now, another thing that your organization has advocated for is civil immunity for some of your organizations. Why is that important?
Yeah, we're seeing it already in the effects of not having civil immunity. And if you look around the country, by my count today, 23 other states have enacted liability protections for long-term care providers, including our neighbors to our east, New York and New Jersey. Regulations are changing every day, whether it's from the CDC, CMS, or the State Department of Health guidelines are changing every day. And providers are doing all that they can ultimately to keep their residents safe. They shouldn't have to do that with the threat of lawsuits hanging over them. And I just told you that there are more than 500 facilities across the state right now with at least one COVID positive resident. If we don't enact liability protections for long-term care providers, those healthcare heroes who are on the front lines of this epidemic, then you can expect to see more than 500 separate lawsuits. And we're seeing it already. We're seeing attorneys from both within Pennsylvania and from out of state kind of going on social media or surfing the media channels and saying, we know that there's been a positive case in this facility, or we know that staff are sick in this facility. Give us a call and talk to us about it. And we've been fighting for liability protections for long-term care for years before the epidemic started. This is only going to heighten the importance and the need for those protections for providers.
Well, we've been speaking with Zach Shamberg. He's the president and CEO of the Pennsylvania Healthcare Association. Thank you for joining me.
Thanks for having me, Phil.
James Hanak is executive director of the Public Cyber Charter School Association and CEO of PA Leadership Charter School here in Pennsylvania. Thanks for joining us.
My pleasure.
Let's start in general. How are cyber charter schools funded?
Cyber charter schools are funded with a basic concept that the money that the public school spends on a child should follow that child to a charter school. So when a student, if your son or daughter were to enroll in our school, we would send a bill to your local school district for, and they send us approximately 75% of what they spend on your child in the home school district to our school to educate in a cyber world.
And are there any boundaries, or is it just the state of Pennsylvania?
It's just the state of Pennsylvania, but it's true that if a student came here and then left the state and wanted to finish up here, the parent could pay tuition and continue, but we don't enroll out-of-state students.
So what is a typical day like for a cyber charter school student?
Well, there is no typical day, and that's the beauty of a cyber charter school. We have some students who work all day long and they go to school at night. We have other students who can't sleep and they get up at 3 o'clock in the morning or 4 o'clock in the morning and they start their school day. But a typical, if there were such a thing, school day would be a student taking that long trip from the breakfast table to their laptop computer, logging on, checking to see what their assignments were, recognizing that a couple of their teachers are already online and they could instant message them or send them emails. And then throughout the day, there might be various online classrooms where the student could do what you and I are doing right now in a Zoom room, but they would be doing it with their teacher who is in a different part of the state.
And who is a typical student? Is it just like any other K through 12 student in Pennsylvania?
There's only one thing that all of our students have in common, and that is that their current school district is not meeting their needs. Whether it's not being challenging enough, or it's too challenging, or there's bullying, or there are special ed kinds of issues where the student just can't function when there's lots of distractions, or an athlete, or someone who is working, or someone who has a unique musical talent that they need more time to practice. All of those things draw students to our school. But the only thing that they have in common is that they can't accomplish what they want to accomplish in their home school district.
And when the pandemic happened and came here to Pennsylvania, how did that affect cyber charter schools in the state?
Well, generally speaking, it did not affect us much at all because we're already online. Our teachers are remote and the students are mostly at home, although a student can go to our school at any place, any time, as long as they can connect to the internet. So they really didn't see much of a difference when the virus hit.
And you're currently the CEO of a school, and you are located at that school. So what goes on there on a daily basis?
Well, some cyber charter schools allow their teachers to teach at home. We have chosen to ask them to come into a building, which they do. We have 180 teachers teaching in four different locations throughout the state. Here in our location, we have all of our high school teachers and all of our guidance counselors. But we do that because we want there to be networking. And I tell people that there's more networking, teacher-to-teacher networking going on in our school in one day than there would be in a regular brick-and-mortar school in an entire year, simply because of the structure.
What about the student-to-student interaction? How does that manifest itself in a cyber environment?
Well, it manifests itself in the same way that you and I are communicating right now. But a student has an ability to connect with their teacher through school mail, email, voice, text, video, whiteboard, instant messaging, and phone, as well as writing letters to each other. Students can do a lot of that as well. And we find that our parents like that because they get to decide who their children's peer groups are going to be, not the school.
So when COVID-19 came, you must have felt like you were ahead of the game here.
I felt like we had the perfect organization to survive the COVID virus scare.
And was there any collaboration with brick and mortar schools to ask you guys, hey, how does this work? How do we do this?
Actually, there's been quite a bit going on. The Pennsylvania Coalition of Charter Schools and the Association of Cyber Charter Schools have reached out. All 14 cyber charter schools have offered to help regular brick and mortars and charter schools as well. And yes, we've had lots of opportunities to train teachers. I got a call yesterday from a friend of mine who's a charter school in Pittsburgh who wants me to help him figure out how to do an online version so that if they can't open in the fall, they can still continue to function.
Speaking of the fall, with the uncertainty of everything and the quarantine still going on as we speak, do you see there being an uptake in enrollment into cyber schools?
We're already seeing that. We're not seeing a flood of new enrollments, but we're seeing about 30% higher than this time last year.
Are you guys ready for that?
I sure hope so. No, we'll find a way to make it ready. And the nice thing about a cyber charter school is that if we get 30 new students, I don't have to buy a new building or find a new classroom. All I need is another cubicle, and we can continue to function. And we do have some room. The hard part is enrolling hundreds of students in late August for a September opening and hiring the teachers to do that.
So how long have cyber schools been around in Pennsylvania?
Well, they've been around almost since the beginning of the charter school movement. And they started as schools that were commissioned or chartered by local school districts. And then in 2004, the state wrote or rewrote the cyber charter school law to have us instead report to and get our charters from the Pennsylvania Department of Education.
And so in that time, how much have you seen it evolve, and what would you say is the current state of cyber charter schools?
I've seen it evolve dramatically when you consider that all day long, every day, I have 180 teachers trying to figure out how to better deliver a cyber education. And we've had 15 years to do that. We spend about $500,000 a year just on software development to make our school more interactive, connective, and user-friendly. So we've done a lot. And it's kind of sad because school districts now are trying to figure out how to do that with only 2 weeks notice. And they're discovering just how hard it really is.
Well, James Hanak, thank you very much for joining us.
It is my pleasure. It's always good to meet you and talk with you, Corey. Have a good day.